10 minutes after 8, and thanks so much for joining us here on Morning Live if you've just done so. And if you've been with us, thanks for staying with us. Now, with the global COVID-19 outbreak, the World Health Organization had to support some African governments with early detection resources as they lacked capacity. The organization revealed that only 2 countries on the continent could actually test for the virus. Experts say that the pandemic has further exposed African leaders and their lack of investment into adequate healthcare services, infrastructure, and of course ending high poverty levels. So to discuss this further, joining us now via Skype is Mbuyiselo Botha, who is a columnist for Sowetan. Thanks so much for your time this morning.
Well, thank you. Good morning, Sakina.
Mbuyiselo, firstly, you actually feel quite strongly about this particular matter, and you've written an opinion piece on the matter. So what voids do you believe the current pandemic has actually exposed regarding African countries?
Well, I think, Sakina, one of the things that it has exposed is, as you rightly point out, and I said it in my piece this past week in the Sowetan, that, Sakina, they have not been able to put resources into their own health services. And for the simple reason that, Sakina, more often than not, they know that the take the next jet and jet out to European countries. Sadly now, that's no longer the case, because even those countries that they would go to ordinarily, they themselves are facing their own challenges.
And of course, looking at the scenario that you've just sketched, the impact, what sort of impact does that have, this lack of action, lack of, doing the right thing and implementing the policies that are on the books? What does that do to ordinary citizens?
Well, it means that there would not be proper services. I mean, the health services would be overwhelmed. They would not be able to have proper diagnosis, proper testing, but also, and more importantly, people will not be able to get the sufficient care that they would ordinarily have to get, Sakina, because the health services themselves would be on their knees. I mean, we as Africans, we would always rely on Europeans to assist and to pour in money. And the question then that all of us need to ask, which is, not an easy one, is why is it that, in this day and age, as African countries or leaders, they have not been able to ensure that their health services are in fact very strong. Look at Ebola. We always have to look at Europe so that they bring their expertise, support us financially, when in fact we know that resources are there. It is how they are misused, how they are abused.
Now, and you touched on this, because historically we've seen African leaders go to other countries, particularly in Europe and Asia, to seek medical attention instead of using facilities in their own countries. Now, if you seek medical attention elsewhere, that clearly indicates a distrust of the systems in your own country, the facilities in your own country, and what you have to offer. So what does that mean then again for the citizens in terms of this COVID-19 pandemic? And many have asked, Mbuyiselo, about whether Africa's numbers are being correctly reflected. How would you actually, respond to that question?
Well, I think that, our Minister of Health has clearly shown yesterday when he was in the Eastern Cape that, there is a pocket of unpreparedness or them not being ready. But it also clearly shows that you have this, the unfortunate scenario where leaders, Sakina, have not even, made it a point that when such pandemics hit us, they are ready. Why? Because there is this eccentric, self-centered attitude that, look, I will not use these services. COVID, if they were to hit them and Europe was less hit, you would know that, or they would know that, Sakina, tomorrow they would take the next flight, or even that day they would take the next flight. But now it actually proves that these cracks that we are now in the same boat, there's nowhere else to go. It means, and that's what I'm saying in the piece, is that I hope that one of the lessons, Sakina, would be that they would reflect and to think differently, that, look, is it not about time post-COVID-19 that we do something that could benefit the people that we are leading?
Why do you think this would change the dynamic? Why would there be a paradigm shift post-COVID-19 when, as you say, we've seen Ebola outbreaks on the continent and the damage and destruction that this has brought to some countries, and nothing has changed subsequent to that?
I think what would change COVID-19 is that we will speak, and maybe it's a cliché when, Sakina, when we always say that every crisis must be looked at as an opportunity. So I think where I'm sitting, that it will bring this mindset shift, in the sense that Africans would not want always to be looked at as a continent, as a dark continent. I think that we're getting into an era, and then one has got to say that we have a president in our country who is in fact best suited as the present chairperson of the AU to actually speak or talk to his colleagues that, look, we can't always be considered as a dark continent, that we are not able to come up with vaccines. Our health services are collapsing. I think that in fact it would give an opportunity for them to wake up and leave out this eccentric, self-centered, selfish thinking as African leaders.
Do you really think that the president would do that? Yes, we are, South Africa, chairing the African Union right now, but do we have the moral authority, firstly? And secondly, do we just have the guts and the will, the wherewithal to actually make such a statement?
Well, I believe in the art of persuasion. And he's proven more often than not that he is the master of persuasion. And I greatly believe in his skills. And we know that from Kodesa, a lot of things that he has achieved as someone who, in fact, does believe in negotiation, in persuasion. So I'm an eternal optimist, Sakina, that we do have a South Africa. And again, Sakina, look at how, as ourselves as a country, we have been able to respond to this crisis. I think that the World Health Organization has lauded us, his leadership has come to the fore. His leadership has in fact proven that, as a leader, there are difficult decisions that one has to take in. And let's be honest that he has not been found wanting. He, as a leader, has actually shown it is doable, it's possible. If, in fact, you lead, because leadership by its very nature means that there are certain decisions that has to be taken that may not necessarily be comfortable, Sakina.
Question for another day that I'm going to park on that. Hopefully we'll have a discussion more about, the AU and persuasion at a later stage. But I want to ask you more to this article that you've written. What would you say are the main factors that have stood in the way of progress in many African countries? And what do you make of right here at home? Hence I ask, do you think we have the moral authority? What do you make of allegations and the allegations of politicization of food parcels, for example, right here at home?
Well, let's call it for what it is. We're dealing with corruption. Call it as it is until we decisively deal with corruption. We will not be able, Sakina, to deal decisively with this pandemic. What you're talking to, it's very sad that there are sections of our leaders who, in fact, and the president has said, it brings all of us to shame to imagine that you can use food parcels as a bargaining chip. You can use food parcels as a tool to misuse and abuse. People that are in desperate need. We must all of us hang our heads in shame. It is, in fact, it says a lot about, our moral compass, Sakina, that in this day and age, these allegations prove one thing only and one thing only, that we are a country that has to deal with corruption and its ghastly consequences, especially as it impacts adversely on the poorest of the poor.
Well, final question, Mbuyiselo. What changes do you hope that this pandemic will bring to South Africa and then to Africa more broadly?
I think what it will bring is that there are areas, Sakina, as I said earlier, that need urgent attention. I mean, we're going into, where we make, health as one of those. I mean, you talk about education. There are many other areas. But all of these things, again, we can achieve them when we really make it a point that we stop this corruption and which has led as a country and as a continent.
Well, thanks so much for your time and your thoughts this morning. Mbuyiselo Botha, columnist for Sowetan, talking to us about his hopes that COVID-19 will actually propel African leaders to invest more into healthcare and also address poverty on the continent. We're going to take a break and then